Good morning and welcome to the Hawaii Health Data Warehouse New Coffee Break monthly webinar series. My name is Tanya Lowry St. John, and I am the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW. We're going to use the next 30 minutes to talk about the sexual and gender minority data collected in the Behavioral Risk Factor Surveillance System, or BRFSS. And I'm going to show you how to access this data using our Hawaii Indicator-Based Information System, or Hawaii IBIS. And if that's a lot of acronyms for you, don't worry, we'll go over them all again. The presentation and the demo should take about 20 to 25 minutes, and then we'll have about 5 to 10 minutes for questions so that we finish up in a half an hour. For everyone's comfort, participants will be muted during the presentation, so please post your questions in the chat box. And our Rico Lee, who is our fabulous graduate research assistant, will collect and ask the questions at specified points within the presentation. The webinar will be recorded and was going to be posted to our YouTube channel for future reference. So let's get started. The Behavior Risk Factor Surveillance System is an annual telephone survey of non-institutionalized adults in Hawaii conducted by the Hawaii Department of Health and in conjunction with the Centers for Disease Control and Prevention. There's about 8,000 adults who are surveyed every year, and their responses are then weighted to represent the entire adult population of Hawaii. Sexual orientation questions have been included in the Hawaii BRFSS since 2006. The exact questions have changed slightly over the years, but the current question is worded, which of the following best represents how you think of yourself? And then participants are read a list of responses, and each response has a number in front of it, and participants are able to answer either with the number that they think best describes themselves or the descriptor. And so the responses are lesbian or gay, straight, bisexual, something else or other, and then not sure, I don't know the answer. In previous years, there's been slightly different response options, and so they have been like homosexual, attracted to, and they would give the person whatever the opposite sex they had already identified themselves as. When we asked them if they're male or female in the survey, they would heterosexual or straight, not gay, attracted to the opposite sex, attracted to men and women. So those are just variations on how the question has been asked in the past. I do have a list of the actual questions that we can get to. We've started asking questions about transgender status since 2014. And the question is, do you consider yourself to be transgender? And people can answer yes, no, don't know, and not sure. And as with all questions, and the previous question is, people can always refuse to answer any BRFSS question that they are asked. You have a right to refuse at any question. If someone identifies themselves as transgender, then the interviewer is prompted to ask them if they consider themselves transgender male-female, transgender female to male, or transgender to gender nonconforming. So we use these two questions about sexual orientation and transgender status, and question that we asked previously about what sex you are, to then create 4 different indicators and dimensions about sexual and gender minorities that can be used in the IBIS system. In these indicators, just to recap though, anyone who has said that they don't know or not sure or refuse to answer the question are not grouped into indicators. Their data is removed from the denominator. That's how that works. Okay, so our first dimension is traditional sexual orientation, and so that's a 4-category variable that someone can be grouped as either heterosexual, homosexual, bisexual, or something else, and so that's just based on sexual orientation alone. The next dimension we have is sexual orientation, and that includes the self-identified sex of the person. So we can then distinguish between health outcomes with or behaviors between heterosexual males and gay and bisexual males, or heterosexual females and lesbian or bisexual females. So that's it's sort of a 2-part. It has both the sex and the sexual orientation. The next dimension we have is transgender status. And so that is grouped into a dichotomous yes, no, because we just don't have enough people at this point, even after 5 years of collecting data, to be able to dig down into the transgender male, female, female to male, or gender nonconforming. And then the last one is sexual or gender minority. So a person is considered a sexual or gender minority if they have answered that they consider themselves lesbian, gay, bisexual, or something else, or they consider themselves transgender. And that is also a yes/no variable. And as you can see, these questions, the transgender questions we mentioned before, has only been asked since 2014. So that data is only available from 2014 forward, as is the sexual or gender minority variable or dimension only from 2014 forward. These are two new dimensions and indicators that we've actually added into the IBIS system for BRFSS for Hawaii starting in 2008. So we were then able to conform all the data from 2014 forward. Are there any questions regarding the questions that are asked on the BRFSS or about these dimensions at this point?
Yes, there are a few questions. The first one is, how do you get participants?
Sure. So participants are basically randomly selected. Not quite a random, they use a weighted random sampling, but they use all of the eligible phone numbers in Hawaii. And so it can be cell phone numbers, it can be listed numbers, it could be unlisted numbers. And so then once that selection of numbers is uh, the selection of numbers is created by the CDC. Once those lists of numbers are selected, then they must be pursued by the folks that are doing our telephone interviewing for us until they determine that it's not a human number or it's a work number or the person refuses to answer the survey. So it is a sort of a combination there, but they use the probability of that number with some other demographics in the collected on the participants to then weight the data to represent the whole population.
The
Next
second
question.
question is, how do you determine who you speak with, or is this done in the schools?
So this is only for adults. So this is for people who are 18-year-olds and older. And when we call the telephone number, if it's a cell phone number, it belongs to that person, then that's the person who we would speak to. If it is a landline number, it belongs to a household. They enumerate all of the adults in the household. And then one of those adults by an algorithm, this is all done with a computer-assisted telephone interviewing system or a caddy. That algorithm selects an adult that has to be interviewed. So the person is randomly selected if it's not a cell phone, that's the landline of the house. Okay, so we can take these 4 sexual and gender minority dimensions in IBIS, and we can use them to in 3 ways. One is we have a demographic indicator section. So if you want to know more about the demographic information about sexual gender minorities in Hawaii, that's one way to do that. The other 2 ways is that in our query builder for IBIS, you have the ability to filter on a population, a sexual and gender minority population only, to find out information about that group. And then also, and this is my favorite, in our query builder step 7, with our display by and our group by functions, you can actually look at any of our 250 plus health indicators for adults in Hawaii by sexual gender minority status. Okay, so let's go ahead and try out some test cases. So what you'd want to do is you'll navigate to our homepage, and so that's going to be hhdw.org. And so from our homepage, to get to IBIS, you can either click here on this orange box here where it says more. Also across the top, we have drop-down menus. If you do IBIS and you know which health data system you're looking at, if it's BRFSS, YRBS, PRAMS, YTS, or birth counts, you can go directly to them by clicking on them this way. I'm going to start here. And so this brings you to our IBIS homepage. And you hopefully received in your reminder for today, because I noticed that a lot of you hadn't really used IBIS that much, or either were new or only used it once or twice. We do have a tutorial here that you can run through to help you with the IBIS system. We also have a step-by-step if you want to follow along to explore, you can do that as well. But these will also be available to you afterwards. And then today's tutorial webinar will also be recorded and be available to folks afterwards. You can then, to go to BRFS data, click on a link directly here in the middle of the page, or you can come to our build a report function and see what data sets we have, and we're going to go to BRFSS. Once you get to the data source, you'll have some information about that data source with the same look and feel across all of our data sources, and we group our data into categories. So the first category we're going to look at is our demographic indicator category. So we're going to check here, and we're going to scroll down, and you're going to see those four sexual, gender, minority, in this case, they're indicators that we have in the system. So you see traditional sexual orientation, sexual or gender minority, and transgender. If you forgot how we define those and what they are, on each of our indicators, you can go over and hover over a question mark at the end, and that will give you information about where that source of that data came from. So let's start by taking a look at the traditional sexual orientation. So we're going to click on here, and this is going to bring us to our standard BRFSS report. Our standard BRFSS report includes all of the years of data, and it includes the data by county. And what's in that report will be here in the query criteria. So you know we're looking at traditional sexual orientation by county for all these years of data. So you can scroll down and you'll see a chart. And here in the chart, you can hover over any of the bars to get information about the underlying data, or you can also come down to the data table that is here below. In this data table, you will see what the indicator is. So it's traditional sexual orientation. In this case, then we'll have heterosexual, homosexual, bisexual, or something else by county. Then you have the point estimate, lower and upper confidence interval, and adults that represents out of all adults. So to read this, we would say, in Hawaii County, the percentage of adults who identify as homosexual is about 2.1%. That is an estimate. We think it's between 1.8 and 2.5%. And that's about 2,900 adults in Hawaii County who identify as homosexual out of 136,200 adults. Okay, so that's how you would sort of read that data table. So you get both the percentage and you actually get a kind of an idea of the number of people that we're talking about. Again, if you keep scrolling down on our standard report, in a case where we have a yes/no variable, we're looking something by county, there'll be a map. See one of these later. We have the data notes, and in the data notes is the question wording. So again, that's where we got this data from. This is how that question was worded. And scrolling down, we have data issues, but I just want to point out to you data sources. So if you're going to use this data in a presentation and a publication, this is our suggested citation. It would be Hawaii State Department of Health, Hawaii Health Data Warehouse, Behavior Risk Factor Surveillance System, the chart title and appropriate years, the URL, and the day you accessed the data. So in this case, our chart title is going to be Traditional Sexual Orientation by County from 2011 to 2018. If you want to export this data to use it for something else, you can export it to Excel here, and that will export the data table and all of the notes and query criteria that surround this query. Unfortunately, the graph does not export. If you really love the graph, you can take a screenshot of it and use it, or a snipping tool, or you can also recreate the graph in your favorite graphing software with the data from the data table. So now if I want to go ahead and then edit this query for looking at traditional sexual orientation, I'm interested in saying, what's happening by age groups. So I'll come up here to modify query definition. And I also say, that's a really long time period. Let me just look in the last 5 years. So I'm going to click here on 2018, and I'm going to hold down my shift key. So now I'm looking at 2014 through 18, and I have little breadcrumbs right here at the top that let me know this is the years of my query. And I'm interested in looking at the information by age group. Once I click here, you can see there's all these different dimensions by which I can look at this variable. In this case, I'm looking at it by age group, and I'm going to hit submit. And I can see here that my year filter changed, that I'm just looking at it for the last 5 years. I'm looking at by age group, but I'm still looking at traditional sexual orientation. And I can see here the 18 to 24-year-olds, 25 to 34, etc., going down. And I'm looking here and I'm saying, okay, let me just take a look. Let's say here under people who identify as bisexual, in the 18 to 24-year age group, it's about 5.3%, going down to 2.8, all the way down to about 0.8% in the in the 75 and older. And let's say that I'm interested in doing, if I would want to, I can actually filter this data to only look at a certain age group for the whole query. But let's say I'm like, this is a lot to look at. I just want to look at this query in just the 18 to 24-year-olds. So I can click on this caret here, and I have the ability to sort the columns or to filter them. And I'm going to filter by people who are just 18 to 24 and hit filter. And now I can see pretty quickly that about 90% identify as heterosexual, and the rest will identify as something else. And this is what it looks like. And if I scroll up, this information is actually also here in my chart. So the chart will adapt itself to the data table underneath. And let's say, well, what was going on with those 25 to 34-year-olds? Then I can come here and I can actually add another filter and say, I want people who are 18 to 24 or 25 to 34. And now I can see both here in my chart and also on my data table. So you have some ability to configure your output once you have run the query. Let me pause right here just to answer these two questions that I see. The first question is asking is if there's 8,000 people that are asked in the state, how do we make sure that we have so many people in each county? So the answer is we do asymmetrical data collection by county. And so they use a combination of the most used prefixes for numbers by county to help achieve that. But if there was a case where you didn't get enough people from some county, then you might have a jeopardize to be able to wait. But they do wait. They sample more heavily from Maui, Kauai, and Hawaii County than they do from Honolulu County because there's so many people here. And the next one is there a minimum count needed for a subset to be included in the table? Yes, and you're going to see that in just a second. Okay, the quick answer is you have to have at least 50 respondents to a question. And we look at what the relative sampling error is as to whether or not the data will be displayed in the table. Okay. So this is looking at the data by age group and traditional sexual orientation. If I want to change it and look by a different indicator, if I click, then I can quickly say, okay, let me look at it by data by transgender, for example. And you can see the same thing. So for Hawaii, again, this has only been asked for the last 5 years. This is the transgender by county. So it varies slightly, but as you can see, the confidence intervals are large. And it's about 0.7% of the population identifies as transgender. So that's about 6,900 adults in Hawaii who identify as transgender. So let's say I'm looking for information about income disparities among sexual and gender minorities. I'm going to come back and select a different indicator. I'm going to select this new indicator we have this year called poverty level. And poverty level combines the annual household income and the number of people in the household. If you want to know exactly how we do this, it's down here in the data notes. But it lets you look at the household size and the annual household income combined. So this is what it's going to look like by county. And let's say at this chance, let's go and take a look at it by sexual orientation, since we looked at traditional sexual orientation last time. And you can see that we have the information for poverty level for heterosexual males, heterosexual females, gay and bisexual males, and lesbian bisexual females. So I'm looking at all this and it's a little much, and I think I'm just going to filter this on sex so I can just hone in on what's happening on female participants. So I can come down here to population and I can filter by sex, only female. So you can see that there. I will submit that data query. And again, it says the years are this year and it's filtered only by sex. And so here it makes it pretty easy to see that heterosexual females, 55.5% say that they're 186% plus of poverty level, compared to only 36.7% of lesbian and or bisexual females. So it just kind of gives you another ability here. You can look at the data and you can also filter to sort of tailor your query to what you're looking at. And the last example I'm going to do is we're going to look at just looking at general health data within the IBIS system. So because my friend Thaddeus is here, we're going to look at screening and preventative services indicators, immunization and preventive health, and we have some new hepatitis B indicators that we've been able to put in the system this year. We finally have enough years of data to do that. And we're going to look at folks who are at high risk of hepatitis exposure. But again, if I want to know what I mean by high risk, I can hover over here, or I also know that data is going to be there, information is going to be there in my data source. So I'm going to click here, and I can see that overall, well, first of all, I see that this question was only asked so far in 2017 and 18, and it's adults who are at high risk for hepatitis B exposure by occupation, hemodialysis, cohabitation, IV drug use, or sexual practices. And again, I can go down here into my data notes to figure out exactly what that meant. Here I have that little data chart because this is a yes/no. And I'm going to scroll back up and I see that basically about 5.1% of all adults in Hawaii are at high risk for hepatitis B. So let's say I want to look and see what does that look like amongst the sexual and gender minority population. I can come and modify my query definition and I can display the data by sexual and gender minority, sexual or gender minority, and I'll hit submit. And I can see that while in the population overall, it was 5.1%, still is, among sexual or gender minority, it's 20.5% are at high risk for hepatitis B exposure, compared to only 4.3% of people who are not a sexual gender minority. I can come here again and say, all right, let me drill down a little deeper. And I'm going to look at, let's look at it by sexual orientation. And I can see here then that among heterosexual males, it's about 4.7%, but for gay or bisexual males, it's about 29.4%. And again, heterosexual females, it's 3.4%, but lesbian and bisexual females is about 13.4%. So you can then use these group by and display by options to then look at any of our health indicators, all 250 plus that we have within the system, to find out more information about the underlying health and about disparate health disparities in the sexual and gender minority population. So I'm going to pause here for questions.
Yes. The question is, can you redesign the program so that any data with less than 50 observations can also be displayed or generated in the report?
So the issue is that the Centers for Disease Control and Prevention has guidance on what they consider to be a reliable estimate, and they do not consider any response less than 50 to be a reliable estimate. So in this case, what we're able to do is we can aggregate multiple years of data. So with something like the BRFSS, if the question has been asked multiple years, you can do that to increase your denominator, but the CDC guidance is to not display any data with less than 50 because of the problem of it being such an unreliable estimate from year to year. And it's not based on population size, it's based on number of respondents. So for example, we survey 8,000 people. If in that year, you didn't get 50 respondents who identified as transgender, we wouldn't be able to report out on transgender for that 1 year. But that way, if we combine the data from 2018 with 17 with 16, enough to get 50 transgender respondents, then we could get reliable estimates for a health behavior or a health an indicator amongst transgender respondents. Okay, great. Well, thank you very much. I appreciate your time, and I hope you guys have a wonderful day. And if you've got extra questions, feel free to email me. You guys take care.